Hello, my name is Enos and welcome back to my channel. This is Work and Wonder. I know I've been away for quite a long time and a lot of you have been asking for most of the mental health stations, and today I'm here with my friend
Collins, and I'm happy to be here, and we are going to take you through some of the talking therapies.
All right, that's fine. I said today we'll be taking you through talking therapies. This is a skill station which is 8 minutes, and it's part of the 6 skills that's out of these 6 you'll be doing as a mental health nurse. And today we are here to practically demonstrate to you how you can go about talking therapy. So without wasting much time, I am going to be the nurse, and
I'm going to serve as the patient.
yes, Collins is going to serve as a patient, and then we'll get to show you how to go about the talking therapies station. And we are using the NMC marking criteria because everything that you do in the Osce is based on the marking criteria that has been provided by the NMC, and this is based on our knowledge of understanding of the marking criteria that we are making a video on, and based on some research that we have done, some papers that we have read on the NMC page and some of the centers to their pages or their website. Based on our understanding of that, that is what we are using to demonstrate to you how talking therapies is done. So without wasting much time, so first of all, we are going to go through the marking criteria with you, what is expected of you as a candidate of the Osce for the talking therapies.
Yeah.
So the talking therapies with the marking criteria, there are basically 13 steps, and you can see that on your screen. The first one is the nurse introducing himself. Then the second point is the nurse checking for the patient ID. That is, you are asking of the name of the patient. And then the third one is you gain consent to continue the visit. And then fourth, you make sure your body is open, relaxed, and then it's non-threatening. Then, of course, the fifth one, you're going to discuss your PHQ 9 questionnaire with the patient. Mostly this PHQ 9 is already pre-filled by the patient when he or she wants to visit the GP. So it's already filled, and the nurse who is coming to talk to the patient about the talking therapies will be given that particular questionnaire. So you will discuss that with the patient, and then you now listen to the patient. You allow the patient time to ventilate his thoughts, his feelings. Then you get to understand the kind of problem. So Collins here will be telling me about his problem, and based on his problem, I'll be able to know the type of talking therapies to suggest. Note that here I am not the one doing the talking therapy. I'm only here to listen to him, to know the talking therapy that will be suitable for him, and out of per what he tells me, I'm now going to suggest that particular type of talking therapy, and then ask him if he's okay with that. Then I'll be able to arrange a section for him. And then, of course, the seventh one, I will talk about the importance of talking therapies. And then the eighth one is I list them and then appropriately suggest or recommend based on what he tells me is his problem. I'll suggest the talking therapy that I think is suitable for him. And then I'll recap all the areas that we have also discussed. And then I'll ask if the 11th point is I'll ask if he has any other questions. If not, then if he's okay with the talking therapies that I have recommended for him, then I will appropriately conclude or end the station. So as simple as that, that is the marking criteria per the NMC. And based on of our understanding of it, we are going to demonstrate to you how talking therapy is done in the skill station of the mental health Osce. Without wasting much time, we are going to go straight into the practical section. Okay, so I'm going to start my station by reading my scenario. The scenario says that you are a mental health nurse posted in the community. You are requested to visit Mr. Collins at his home by his GP for a section with you regarding his presentation. Kindly listen to the patient discussing any therapies you feel may help his condition. A PHQ 9 has already been completed by Collins. You will need to calculate the score and refer the scoring outcome table for the results. Please discuss the outcome of your assessment and the PHQ score with Freya, consider the most appropriate therapy for the patient. So I've read the scenario. It says that it's a community, so I'm going to go into Mr. Collins's house. Knock, knock. Is the nurse from the community? Please, can I come in?
You can come in.
All right. So I enter into the room. I assess for scene safety. The scene is safe to approach. Hello, good morning.
Good morning.
My name is Enos. I'm the nurse from the community, and per your referral from the GP, I'm supposed to be here to do a talking therapy with you. Is it a good time to do so?
Definitely, it's a good time.
All right, please, can I have my seat?
Oh, sure, you can.
All right, thank you. How have you been?
I've been down, but
As I said, I'm the nurse from the community, and the GP has referred me here to do a talking therapy for you. But before we continue, please, can you tell me your full name and your date of birth just to confirm that I am with the right patient?
okay. My name is Collins Johnson.
Collins Johnson.
My date of birth is 5th of January 1998.
All right, so Collins Johnson, 5th of January 1998. All right, Assessor, I can confirm that I am with the right patient. Please, and is this a good time for us to talk about talking therapies?
It's okay.
All right. All right, so as I said, I'll be referred here to talk to you about talking therapy. So I'm basically here to listen to you, and then out of what you tell me, I'll be able to recommend a talking therapy that will be appropriate for you. Is that okay for us to continue?
Yes, okay.
All right. So Collins, can you remember this PHQ9 when you went to visit the GP?
Oh yeah, I remember.
You remember filling it?
Yeah.
All right. Okay, so basically the questions were presented to you, and then you allocated some marks based on how you were feeling, and based on this I have calculated the PHQ9 you had a total of 18, and based on that, that is gives you a provisional diagnosis of moderately severe depression. All right, so Collins, can you please tell me what happened? Is that okay if I call you by Collins?
Oh yes, okay. I don't mind.
That's fine. Can you tell me what happened?
Well, I recently got broken up with my girlfriend, who's currently now my ex, and ever since the breakup, I just feel like it was because I wasn't enough for her. I didn't provide enough, and I've just been quite down. And I just hate myself. I don't know why, but I've just been quite depressed, and it's been very difficult coming out of the house, or even going out, or even communicating with friends. I've just been, down, and I've actually been depressed before in the past.
Okay.
That was earlier on in my teen years. I've been depressed, but I had some therapies, some counseling, and it did work for a while. But I think this one is bad. I'm just very tired. I'm almost giving up and everything.
I can understand how you feel. If I heard you right, you did had some therapy counseling back then, and
Yes.
did you complete this therapy?
Oh yes, I did complete the
And
therapy.
it still didn't help you.
To an extent, it did help, I would say, because my mood improved. But, I think what triggered it up again was just this breakup.
Okay.
And it has been reflecting on my life. And
I'm so sorry to hear about that, and I can understand your pain. Um, so Collins, that is the more reason why I am here to listen to you ventilate your thoughts and your feelings, so that I'll be able to recommend an appropriate talking therapy for you. By listening to you, at least I have an idea of what you are going through, and I can understand that. But before that, talking therapies is very good for such situations because able to help you. First of all, it allows you to be, or it gives you time to talk to somebody. You can shout, you can cry, just whatever you are feeling, you can bring it out to the person. The person is willing to help you out. Again, it also assists you to find answers to your own problems, right? The person helps you to explore yourself in order to find answers to your own problems. And sometimes it's also better even talking to strangers than your own friends and then relatives. Again, it also allows you to see your problem in a different way. But I must say that talking therapies doesn't necessarily take the problems away, but it allows you to be able to find solution your own problems that you are going through. All right, and we have so many types of them. You first did one which you said you did counseling. You completed the section. It did help in a way.
Yeah.
Aside the counseling, we also have the CBT, which is a cognitive behavioral therapy. That one is also there. We have the mindfulness base. We have the psychotherapy, and then we have the interpersonal talking therapy. So all these are types of talking therapies that based on what you are feeling or what you're going through, can be suggested to you. By listening to you keenly, I will recommend the CBT, which is a cognitive behavioral therapy. This particular therapy is very focused, right? And it looks at your present problem. And looking at your problem, it was because of the breakup which happened recently. So this particular one that I'm suggesting to you, you will have the chance to speak to the professional who is going to address that current problem and allows you to find answers to, some of the problems that you're going through. And then here too, it is quite obvious that you think or you have the feeling that you are not good enough for the person, and all of these are thoughts
Yeah.
that is submerging you. And once you meet with a therapist, the therapist is going to talk to you, help you to see yourself in a different way, which is going to help you very well. And then you can have about 15 to 20 sections, and each of these sections lasts for about 30 minutes to 60 minutes per section. And then, as I said, it's going to really help you to see yourself in a different way. Then at the end, you should be, it should be able to help you to come out of this problem that you are having, right now. And then basically, that is all about the CBT. And do you think this is something you'll be able to work with?
Well, definitely, I think it's something I'll be able to work with. At least I'll be willing to try.
All right, that's fine. And then, as a source of a backup, I would also want to add another one just in case this one doesn't really go well. I also suggest interpersonal, talking therapy. Basically, this one deals with the relationship. And because here there is a relationship at stake, basically, this one, the therapist might be able, should be able to bring in your partner, and then this problem that you're having, you'll be able to settle it among you amicably. And because once you have a problem with somebody, it can also have effect on your thoughts, your feelings. And once this problem is solved, it should be able to help you to come out of your depressive in this depressive state, which is really going to help. So just in case the CBT doesn't really go much as expected, you can also think of the interpersonal. Do you think you'll be able to deal with this?
Definitely, I think I'll be able to do it.
All right, that's fine. So, Collins, it's been a very fruitful section. I've come in and then we've spoken about talking therapies. As I said, I came here to recommend one to you based on what you tell me or your problems that you have. We've gone through the types of talking therapies and then the importance of talking therapies. I've suggested two of them to you, which you said you are willing to undertake with the professionals. So basically, what I will do is that I'll get back to the GP and then tell the GP or put it into writing that you have accepted to do CBT and then the personal talking therapist. You've accepted to do that, and then we'll try and reach out to the professionals, schedule a date, and then see how you can start this. Is that okay by you?
It's okay by me. It's
All
all
right,
right.
great. Do you have any questions for me, Collins?
Um, okay. How long does each sessions last?
Yeah, 16 to 20.
Okay.
Yeah, 16 to 20 sections per any of them, but it could be more than that or it could be less than that depending on how you are able to follow along. Sometimes they start with people and then within the very first, second, third week they are okay. Some people also undergo it for months. Yeah, so depending on how you are cooperating and how the section is helping you as an individual.
Thank you.
Is there any other questions?
No, I don't think so. Thank you very much.
All right, so I'll end the section or I'll end our discussion here. If you have any question, don't hesitate to call the GP at working hours, or if you feel your depressive state is, making you have thoughts of harming yourself and all of that, don't be hesitant to call 999 or 111 for assistance. Is that fine?
Yeah, definitely.
All right. So, Collins, I'll end here and then I'll go and I'll see you later.
Okay. Thank you very much.
All right. Bye bye.
Bye.